So,
Hello, everyone. If you can hear me, please type it in the chat box. Thank you for attending our Dental and Vision for Active Employees webinar. We'll start with a pre-recorded overview. Your microphones will be turned off and muted during the presentation, but feel free to type any immediate questions you have in the chat boxes. Our representatives are here to help, and after the presentation, you'll be able to hear your questions answered by our representatives. And with that, let's get started.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025.
thank you all for the short pause. I'm coming through. I'm going to restart our video, knowing that the picture wasn't at full screen. So just give me a moment and we'll start that again.
Time allows during the Q&A portion of the presentation. Important. Please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SF-HSS members, which can be
Thanks,
found
everyone.
at
I'm going to ask Jay if we can stop the video, and we're going to need to redo it. Thank you all for your patience. Jay, I'll take over the screen and the sound.
Sure.
And then thank you for everyone for being active in the chat and just letting me know so we get the screen in full presentation mode.
System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important, please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SF-HSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SF-HSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Hi, I'm Morgan, and I want to thank you for taking the time to learn more about your benefit offering through VSP Vision Care. With VSP, our goal is to help you see well and be well for a lifetime of good vision. Let's take a look at the great vision benefits available to you. We understand you've got a lot of choices to make during open enrollment, so we'll make this simple. Why enroll in a vision plan with VSP? First, vision care is essential. Signs of over 270 health conditions can be detected during an eye exam, so it's important it's on your wellness checklist. You get savings that really stack up. Great everyday savings on eye care and eyewear, plus loads of extras so you can save all year long. You can choose high-quality care from our huge network of private practice and retail chain locations. Plus, you can shop online on Iconic, founded by doctors focused on you. Your well-being is at the core of everything we do. On the last slide, we mentioned that vision care is essential. Why is that? It's the only non-invasive way to view your blood vessels. That's how your eye doctor can detect over 270 health conditions during an eye exam. And in some cases, like diabetes, an eye doctor can be the first to detect certain conditions like diabetes, HCMS study. Even if you don't wear glasses now, your vision can change from year to year. Vision care is an easy way to keep you and your family healthy, so make sure it's on your wellness checklist. So now we know why vision care is so important. Let's take a look at how, as a not-for-profit company, VSP makes it affordable for you. With your benefit, you get great everyday savings on eye care and eyewear. So, what kind of savings does that add up to? VSP members save an annual average of $471. Check out your member benefits summary for details. So, now we know why vision care is so important. Let's take a look at how, as a not-for-profit company, VSP makes it affordable for you. With your benefit, you get great everyday savings on eye care and eyewear. So, what kind of savings does that add up to? VSP members save an annual average of $471. Check out your member benefits summary for details. You can opt for lens enhancements like anti-glare to reduce blue light impact or progressive lenses so you can see near or far. Check out your member benefits summary for details. You can opt for lens enhancements like anti-glare to reduce blue light impact or progressive lenses so you can see near or far. Check out your member benefits summary for details. Retinal screening is a quick scan that shows images of the inside of the eye. It can be used to detect disease as a baseline of a healthy eye. Compare year after year to detect even subtle changes. With your VSP coverage, you get a retinal screening each year for no more than $39. And members with diabetes receive a retinal screening fully covered each year. With VSP Light Care, it's easy to defend your eyes from the sun's ultraviolet rays or from blue light from screens. And you don't even need a prescription. Simply visit your VSP network doctor and choose ready-made blue light filtering glasses or sunglasses. This is an especially good option for parents with children who don't need corrective lenses. With essential medical eye care, here's what's covered. Fully covered retinal screening for members with diabetes who do not have diabetic eye disease. Exams and services to treat immediate issues like pink eye and sudden changes in vision. Treatment options to monitor ongoing conditions such as dry eye, diabetic eye disease, glaucoma, and more. This coverage is supplementary, and in most cases, your health insurance will be billed first. You may be able to coordinate with your VSP benefits in order to help reduce out-of-pocket costs. If your VSP doctor doesn't participate with your medical insurance plan, VSP has you covered with only the cost of your copay. You've seen the everyday savings has built your VSP plan. Now, let's take a look at ways you can stack your savings. How about an extra $20 to save on featured frame brands? 50% off additional pairs of glasses and sunglasses at VisionWorks. Prefer to shop online? VSP members save an average of $250 at Iconic, plus free shipping and returns. Plus, VSP members have access to exclusive member extras, like 60% off a pair of hearing aids from True Hearing, and so much more. VSP was founded by doctors. That's why we make it so easy to find one that's right for you. With thousands of private practice doctors and over 700 VisionWorks retail locations nationwide, getting the most out of your benefits is easy at a VSP Premier Edge location. Your benefits go further when you visit a Premier Edge location, with access to exclusive rebates and offers such as Premier Edge Promise, a worry-free eyewear guarantee, exclusive offers and savings, and advanced exam technology including digital retinal imaging and more. And if you prefer to shop online, you can choose from a variety of well-known name brands and contact lenses. Choose from over 70 eyewear brands and over 1,600 styles. Iconic is a VSP-owned company and the only website that seamlessly connects VSP Vision benefits to a member's account. By applying your Vision benefits, you see savings in real time. As a VSP-owned company, Iconic is the only website that seamlessly connects VSP Vision benefits to a member's account. By applying your Vision benefits, you see savings in real time. Save time and money on quality eyewear with a few easy clicks. 1. Connect your Vision insurance. 2. Select your product. 3. Upload your prescription or provide your doctor's contact information, and we'll take care of the rest. Iconic offers a variety of well-known name brands and contact lenses. Choose from over 70 eyewear brands and over 1,600 styles. We understand that choosing a doctor is a personal decision, so we've made it easy to find the right care for you. Simply navigate to find a doctor on VSP.com. Enter the preferences that are meaningful to you. Can mention a few depending on who you're talking to. You can even use the slider to search by distance and view your choice on a map so it's easy to see how quickly you can get to each location. We also get you're busy, so we've put everything you need in one place. Your personalized dashboard on VSP.com. Before your doctor visit, view your benefit and check out special offers. After, you can view your claim and even download your Vision savings statement to see how much you saved. You can even take a diabetes risk assessment. And it's easy to toggle back and forth between family members with the Switch Member feature next to your name. VSP helps you see well and be well with the coverage and quality care you deserve. Enroll today by calling VSP Member Services or by visiting us online at VSP.com.
Here's how your Delta dental plans will help you shine. Released in 2000, the first ever Surgeon General report on oral health emphasized the importance of oral health to overall wellness. The terms oral health and general health should not be interpreted as separate entities. Oral health is integral to general health. Oral health means more than healthy teeth, and you cannot be healthy without oral health. We now know that the mouth serves as a mirror, showing us information about other parts of our body, like systemic disease and cancer. This visual shows all the ways that our oral health can affect our overall health. Poor gum health and tooth loss can increase your risk for a variety of chronic conditions and health issues, including those shown here. Gum disease is associated with an increased risk of preterm birth, as well as low birth weight and other pregnancy complications. Oral health can even affect your mental health. Oral health issues such as untreated cavities and tooth loss may result in serious mental health issues, including depression, social anxiety, and low self-esteem. There are plan features that are here to assist with maintaining good oral health. On the DHMO plan, low to no cost copayments. On the PPO plan, diagnostic and preventive maximum waiver and SmileWay benefits that we will highlight in the presentation. Now let's take some time to go over your plan options. Let's go over the DeltaCare USA plan first. The DeltaCare USA plan offers many advantages, including most covered services at a no-cost or low-cost copayment to the member, no annual maximum, no deductible, no claim forms to fill out, predictable costs as your benefits guide shows all covered services and what your copayment is for those services. Getting started with DeltaCare USA is easy. Go online to look up DeltaCare USA providers. Then visit any DeltaCare USA general dentist that is accepting new patients. When your dentist files a qualifying claim, you will be added to their roster and they will become your assigned DeltaCare USA dentist for any future appointments. You must visit this dentist for future visits to receive benefits. You can change your general dentist by contacting Delta Dental by phone or through your online account. Provider changes made between the 1st and 15th of the month are effective immediately. Provider changes made on or after the 16th of the month are effective the 1st of the following month. When you visit the dentist, you don't need to bring an ID card to receive treatment. Just provide the dental office with your name, social security number or enrollee ID, and your date of birth. Your dentist will work directly with us to complete any necessary paperwork, so you don't need to worry about any claim forms. Just pay your copayment if you have one at the time of treatment. Read your plan booklet to learn more about covered procedures and copayment amounts. Specialty care is available with a referral from your primary care dentist. For out-of-area emergency care, if you need urgent care and are away from your primary care dentist, DeltaCare USA provides a limited allowance for care. A few details to keep in mind. You will be required to pay for treatment and request reimbursement. Refer to your plan booklet for specific coverage details and procedures. Let's take a quick look at some of the covered services and copayments. As you can see, there are no deductibles to meet and no annual maximum. We have highlighted some of the more common dental procedures and their copayments. Here is a look at the orthodontic coverage for children and adults, which includes all phases of ortho treatment, pre and post records, tooth extractions, and coverage for ortho progress in treatment. It also shows you the startup fee. Now let's take some time to get to know your Delta Dental PPO plan. Maximize your savings with a PPO dentist. Get the most value from the PPO plan by choosing a Delta Dental PPO dentist. You do have the flexibility to see any licensed dentist. You can visit any licensed dentist and receive coverage. You won't be charged more than your expected share. PPO network dentists agree to set fees. This means you won't be balance billed. You won't be charged more than your expected part of the bill. Here is a glance at your PPO benefits. You have no deductible. Annual maximum is $1,250 per person each calendar year, with diagnostic and preventive services waived towards the maximum. You can see there are 3 columns, all with different percentages shown. The percentage shown on the benefit sheet is the percentage that Delta will pay when a claim is incurred. As you can see, the percentage is highest when you use a PPO in-network dentist. We encourage you to use a PPO provider as they discount their fees the most. It is slightly lower when you use a premier dentist. When you stay in network and visit one of these dentists, you won't get charged more than your expected share of the bill. Using a non-Delta dentist or out-of-network dentist may result in balanced billing and higher out-of-network costs. Please note that nitrous oxide and non-IV sedation are also covered on the PPO plan. You can save money with the diagnostic and preventive maximum waiver. Cleanings, x-rays, and exams fall under this category. When receiving those services, they are waived from your annual maximum, saving your benefit dollars. This slide is an example. If you went to the dentist and had an oral exam, x-rays, and cleaning, and the treatment cost was $350. With the diagnostic and preventive maximum waiver, your annual maximum does not go down to $900. It is still $1,250 for the year to be used on other services. Your plan includes the SmileWay Wellness benefit, which offers enhanced coverage for higher risk enrollees. The health of teeth and gums is tied to overall wellness. Gum disease and tooth decay are associated with a number of systemic conditions, and enrollees with certain medical chronic conditions may benefit from additional teeth and gum cleanings. Delta Dental PPO enrollees can take advantage of expanded coverage if they've been diagnosed with the conditions listed on this slide. Members can self-report via their online account, and it's entirely confidential. To summarize, let's take a quick look at the differences between the PPO plan and the DeltaCare DHMO plan. In choosing a dentist, PPO plan, you can visit any licensed dentist, but we do encourage you to use a PPO provider for greater savings. DeltaCare USA plan, you do have to seek services from your primary care dentist. The PPO plan has an annual maximum, where the diagnostic and preventive services do not count towards that maximum. On the DeltaCare USA plan, there is no annual maximum or deductibles. On the PPO plan, covered services are paid at a percentage. Delta pays a percentage of the services, member pays a percentage. On the HMO plan, all of the covered services have preset payments, which are low cost or no cost. On the PPO plan, there is no referral needed to visit a specialist. On the DeltaCare USA plan, you do have to go through your primary care provider to coordinate coverage for a specialist. And for the PPO plan, the dentist will file a claim form for you if they are in network. If they're out of network, you may have to submit the claim. And on the DeltaCare USA HMO plan, there are generally no claim forms to file. We do encourage you to visit your customized website, deltadentalins.com/CCSF, for a myriad of things you can do. Our website has a wealth of information that you can access without logging in. Search for a nearby dentist in your plan's network. Be sure to choose your plan in the drop-down menu, either PPO or DeltaCare USA for the DHMO plan. You can find answers to common questions about dental care and managing costs in our enrollee support guide. Find extensive dental health and wellness information on our website. And you can also sign up for GRIN, which is our free dental health magazine that would come to your email inbox quarterly. While you don't need an ID card, if you do want one, you can log in and print your own. As a Delta Dental member, you are eligible for these member perks. Virtual dentistry, which is a video-based platform that allows you to speak with a dentist live on your phone or device. Brush Smart is a discount program on Philips and Oral-B oral healthcare products. You can also get discounts on hearing aids through Amplifon and LASIK through QualSight. Life Perks, which gives you instant access to offers from a rotating group of merchants. You'll also receive emails that let you know about the newest discounts. And wellness resources, which include online articles, recipes, videos, and more. Scan the QR code for instant access or use the URL listed here. We do invite you to socialize with us on our social media sites where we offer up-to-date dental information and wellness tips. We thank you for your time and we're pleased to take your questions.
Welcome. My name is Monica Andrade, and today I will be discussing your dental plan options through United Healthcare. Your employer offers 2 different plans and a range of services from routine checkups, cleanings, to advanced procedures, ensuring you receive the best care possible. With flexible options and affordable rates, maintaining your dental health has never been easier. With the Direct Compensation Dental Plan, you have the freedom to see any dentist in our statewide network without having to choose a primary care dentist in advance. Of course, a primary care dentist can be helpful guiding and managing your oral health. So you may want to choose one anyway, or see if your regular dentist is in the network and that there is one near you in your preferred area. If you need to see a network specialist, you'll just need a referral from your dentist or contacting United Healthcare Customer Service Department. The plan is designed to fit your life in other ways too. You have no deductibles or annual spending limits, just a fixed copay for covered services and treatments. Coverage for hundreds of different dental services like crowns, braces, and silver fillings. Plus, we also have oral cancer screenings for adults 18 and older, and extra dental visits during pregnancy and the first 3 months after giving birth. Finally, preventative care is most often covered at 100% in the network with a zero copay. The oral cancer screenings just mentioned, for instance, are covered as well as preventative care. Remember that if you decide to see a dentist who's not in our network, it won't be covered by your plan, so it's a good idea to stay in the network. Who's eligible? Employees and retirees, along with their eligible dependents that would include their spouse, domestic partner, and children up to the age of 26. It's easy to let regular dental exams slip through the cracks when life gets busy, but they're crucial for maintaining your overall health. Explore your dental care options to find the best fit for you. Embrace retirement with a confident smile and discover what you've been missing. Prioritize your dental health by learning about your options so you can keep your smile bright and your life healthy. Good oral health may be linked to reducing the costs and complications of many high-risk, costly conditions such as diabetes, heart, and kidney disease. Our whole person approach is designed to link medical and dental data to help close gaps in dental care for employees with chronic conditions, with the goal of helping improve overall health and lower costs. Gaps in oral care are characterized as a lack of oral health care received within the previous 6 months, as well as the type of oral health care being received. For example, have you been able to get the appropriate periodontal and preventative care for your condition? We can help you identify closing those dental care gaps that may help you achieve better health and save money. Now we would like to discuss condition-specific data. Diabetes. People with diabetes are more likely to have gum disease. If left untreated, this can make it difficult for them to stabilize their blood sugar. However, those who receive gum disease treatment may see a positive impact on their blood sugar levels. Heart health. People with gum disease are nearly twice as likely to have heart disease. Pregnancy. Gum disease in pregnant women may be linked to complications such as preterm birth and low birth weight. Asthma. Employees taking asthma medication may be at risk of cavities, dental erosion, and periodontal diseases. Kidney disease. Treating gum diseases helps reduce inflammation, which can help reduce the risk of kidney failure. COPD. Periodontal disease may increase the risk for respiratory disease. We address individual needs with a whole person approach that includes both preventative and at-risk outreach. 90% of targeted employees were successfully reached by phone and/or mail. Preventative care includes wellness benefits covered at 100% in the network, 2 routine checkups every year, extra cleanings and treatments for expectant mothers, annual oral cancer screenings for covered adults ages 18 and up. We help at-risk employees through enhanced benefits that provide additional preventative and periodontal benefits, including expanded coverage for pregnant employees. Our dental activation combines medical and dental data to help identify at-risk employees and assess whether they're getting dental care to manage their condition. The timely interventions also encourage employees to seek oral health care. Although many services are at no cost to you, there are some services with a copay cost. Please remember to refer to your plan summary for additional information. MyUHC.com helps make it convenient for employees to learn about and maximize their benefits. The updated look and feel to create an experience that is simpler to navigate and understand. Improve usability of content and visuals by focusing on plain language standards and clearly presented information and prioritized actions. We have common navigation, look and feel across all digital assets that includes our websites and our app. With myuhc.com, employees can find a dentist, which makes it easier to locate a network provider who is nearby. You can also get health and wellness information to learn how oral health impacts overall health. Manage your claims. You can view claim history and pay a provider. Look up your benefits. See what's covered by your plan. Easy to access and print your ID cards, which is a convenient way to show proof of coverage. Use a calculator. The cost calculator will help you find what your plan pays for a procedure and what you as the employee will have to pay, and also compare local provider fees. Once you're enrolled, you'll find information and easy-to-use tools on your member website at myuhc.com and in the United Healthcare app. Together, they make it easier to get the most from your dental plan. You can find a network provider near you to go through your dental plan details, review your claims, and find answers to common dental questions. You can also download and print an ID card. With your United Healthcare plan, keeping up a dental visit is designed to be easier. Simply show your ID card when you visit your dentist. You'll be taking advantage of special network rates. Then, when you're at your visit, you'll only pay the office visit copay along with a specific copay for each covered service. Those copays will depend on your plan design. Finally, once you've had your procedure, you're all done, and your claim will be submitted for you. A few points to remember. Our network provides access to board-certified dentists, ensuring top quality care without the hassle of deductibles, annual maximums, or waiting periods. You won't need to fill out claim forms for covered services, making your experience seamless. Enjoy low, predictable dental costs while benefiting from good oral health, which may help reduce the costs and complications of high-risk conditions like diabetes, heart disease, and kidney disease. We address individual needs with the whole person approach, focusing on preventative care and at-risk outreach. Our coverage is network only, ensuring you receive care from the best providers. For additional benefit information, don't forget you can also log into your yuhc.com/SFHSS website. Your 2025 benefit information will be uploaded into the portal for easy access. Additional information found on the website, remember, will be searching for a provider, digital tools to access estimated costs, your health plan ID card, and view balances with claim details. We also have wellness resources that provides free program and activities in physical health, healthy eating, stress management, and flu prevention. Ready to enroll? Review your plan materials and take the opportunity in today's session to ask benefit information that may be helpful in choosing the best option for you and your family. Thank you for allowing United Healthcare to be your trusted healthcare partner.
All right. At this point, I'll check to see if there are any questions that we have missed, and our representatives can try to answer them. And with us today, we have Nancy Jackson from VSP, we have Julie Fernandez from Delta Dental, and we have Monica Andrade with United Healthcare Dental. And again, they have answered some of your questions already in the chat boxes, but at this point, if you have any more new questions, please feel free to type them in. You are still muted, but our representatives can unmute themselves and answer those questions. And if there are no other questions at the moment, I can go ahead and read some of the questions that have already been answered so they can be recorded in this webinar. So seeing no other new questions, I could reread this one. This is from Joel Russo. It says the question is, Delta Dental has changed what it pays out. For example, cleanings, cavity fills. In the past, 2 cleanings per year were covered in full. They no longer are. Is there any other options? And Julie responded, if you visit a PPO Premier Dentist, exams and regular cleanings are covered 100%. If you visit a non-contracted dentist, they can balance bill you the difference, and the co-insurance is 80%. Fillings for simple cavities are covered at 90% for PPO providers and 80% for Premier providers and 60% for non-contracted. Non-contracted can balance bill you the difference in their submitted fee and the approved amount in addition to the co-insurance. So hopefully that makes sense. And again, if you want to piggyback a question on that, feel free to do so on the chat box there. Another question that was answered was, let's see, could you elaborate on the new feature with Delta Dental PPO regarding addition of CT imaging? How does it correspond with the panoramic film once in a 5-year period? In general, I have difficulty finding a clinic which can provide a panoramic film. Any suggestions on how to locate one? And again, Julie had answered that one, which is CT imaging is covered under the major co-insurance and the frequency is limited to once every 12 months. Panoramic and full mouth cross-check and are available once in a 5-year period. You can ask your dentist if they have can offer CT scans, and it is more common with oral surgery, endodontic, periodontal, and implant services. So hopefully that answered your questions. And I think I saw a new question come in. Let's see. I guess we'll switch it up here. There's one here for VSP from Liang Xinxu. Is non-prescription sunglass covered under VSP basic plan?
Hi, so you guys do have our Light Care program. However, non-prescription sunglasses would only be covered if you don't require any prescription eyewear. So if you're not getting lenses and frames or contact lenses, you can then use your 150 frame allowance on non-prescription sunglasses at the provider's office. But if you are a glasses and or contact lens wearer, non-prescription sunglasses are not covered. However, usually at the provider's office, they do discount it by about 20%.
All right, thank you, Nancy.
No problem.
And a new question came in. Are there going to be more dentists in network for Delta Dental in 2025? Since currently there are more dentists dropping, and when I checked the directory, only a few dentists are left in the North Bay and in San Francisco. Julie, if you could touch on that, please.
Yeah, I'm sorry that's that you're having a hard time finding a dentist. Delta continues to recruit and bring on dentists continually. We actually have 51% more dentists in the North Bay area than our competitors. So if you need to go online and use the filters to search to extend, from the 5 miles to 10 miles to 20 miles. But yes, we do not stop recruiting dentists and bring on new ones continually.
Great, thank you, Julie. And again, we'll switch it over to our HSS representative since Yaka's here. There's a question: if I add my child to my benefits now as a first-time addition, can she immediately start using the insurance?
Hi, Sue. So if you add your child during open enrollment, the benefit gonna take effect January 1st, 2025. If you add your child with the qualified event, approval, loss of coverage is depend on the effective date. Then you can start using it right away. So it depends on the how you add it, with the qualified event or the open enrollment event. Open enrollment, you can add it. Open enrollment event ends on October 25th, 2024. It will take effect January 1st, 2025.
Got it. Yeah, so if it's a qualifying event and they make a change, when will that take effect? Is that immediate also?
Yeah, that will take effect immediately. So it depends on the approval, loss of coverage. So we're gonna look at the letterhead, the names, and the termination date, and depend when member gonna submit it or when. So and it still depend on the members' pay group. It's gonna be a monthly or biweekly. If it's a monthly member, it's gonna take effect the first of the month. If it's a biweekly, it take effect every other the first day of the Saturday. So it all depends. So just call us. We can go over with you the detail. Our phone number is 628-652-4700.
Thank you, Yak. Maybe if you can type that in the chat box so they could see it. There's another Delta Dental question here. Hi, I have Delta PPO. The annual maximum is $1,250. Does that mean the most I would pay out of pocket in a year is $1,250? For example, if I needed a root canal and a crown in the same year that costs over $4,000, would Delta PPO cover $2,750 and I would only be responsible for $1,250?
It sounds like this is probably the retiree plan, because the annual maximum for the retirees is $1,250, whereas for the active plan, for PPO, it's it's $500. So the annual maximum, what an annual maximum means, regardless if you're an active employee or a retiree, is the most the plan is going to pay. So if the plan that you're on is the retiree and it's $1,250, that's the most benefit dollars you will have available. If you need to get services like a root canal, major services, we always suggest that you do a pre-treatment estimate. It's not a pre-authorization, it's a pre-treatment estimate. That way you'll know all the dental codes that are being submitted, and you'll know how they will process and pay, and you'll know what will be covered and what will not. There's too many variables in this, because with the root canal, you need to know the dental code. Are you staying in network? Are you going out of network? And that's why we, again, suggest that you would have the dentist submit a pre-treatment estimate.
Great. Thank you, Julie. And another question came in. My dentist retired in 2022. I have not seen a dentist since then, even though I have maintained or continued coverage under Delta Dental PPO for active employees. Do I need to do anything else before contacting another dentist?
You do not. And I was typing up a response to that. So that's okay. I was typing. No, you're fine. I haven't hit enter. So no, you do not. If your dentist retired, under the PPO plan, you have freedom of choice. You can go to the microsite, and I'll try to get that in there, where if you don't have another dentist, you can use the find a dentist feature. And from there, you can put in your zip code. If there's a specific dentist that you, if you're looking for specific services, you can, you filter by that way as well. But there's nothing you need to do. When you go to the new dentist, you need to provide them with your information. Delta Dental, you all have web ID cards, and they can verify coverage with us directly by calling. So.
And then another one, Julie, I think they just need the phone number and the best website to locate a dentist. If you can maybe type that in
I
the
will do that.
inbox. And then for VSP, well, basic VSP plan does it cover severe dry eyes issues?
Yeah, so typically the assessment of the dry eye is covered under our essential medical eye care program, which does have a $5 copay per office visit. However, if further follow-up appointments or treatments are needed, those specific treatments may be covered under your medical plan rather than your VSP plan. But definitely that initial kind of assessment is covered under our essential medical eye care program.
Got it. Thank you. And I saw you type that same information, so I was a little late there seeing that. Sorry.
No worries.
But it's recorded, so it's great for our webinar. Wanted to see if there are any UHC questions. I think I've seen one, but I couldn't dig deeper here. It's probably right in here somewhere. Yeah, I don't see it. Again, at this point, feel free to ask any other questions. These are all great questions. While we have our representatives here, don't be shy. We still have about 10 to 12 minutes more of this webinar. And for our representatives, or Holly, if you see any other questions that I've missed, I think everything else was answered. I think there's a simple question here all the way back in the beginning. It says, what does it mean by no annual max? And I think this goes up for Julie and Monica. Not sure what the context is, but
yeah. So, and I did reply the same question. I wasn't quite sure what the context meant, but no annual maximum from the Delta Dental PPO plan. So you have your annual maximum that's available per calendar year per person, $2,500. Under the PPO plan, you have the diagnostic and preventive maximum feature, which means your diagnostic and preventative services do not count towards the annual maximum. So I wasn't sure if that's what your question was. And then additionally, there is the Smileway wellness benefits, enhanced benefits actually. So if you have one of the 14 qualifying chronic conditions, then you have certain procedure codes that do not count against the annual max. So we're saying that those codes, if you seek those services when they're processed and paid, it still leaves that $2,500 intact for any other services.
And I think Aya has a follow-up question there. Other than the Delta Dental PPO have no annual max, what does that mean? I don't know. Does that make sense?
So on the Delta Care USA plan, on Delta Dental, there's no annual maximum. So there are, if you need to do, there's no annual maximum. So it's basically that copayment booklet is what your copayment would be for any of the services. So that is a difference in the plans between the PPO and the Delta Care plan.
And for the UHC plan, there is no annual maximum for the actives or retirees.
Great, thank you, Monica. And again, feel free to type in your questions there. In the meantime, I'll post our member services phone number here in case anyone needs it.
This is Holly. I'm just coming in to reiterate what Jay mentioned in the chat, is that this webinar, along with all of our other webinars this month during the open enrollment period, are being recorded and will be posted within a few days of the live session. So Jay, I believe, put that in the chat. Yep, recorded videos on our events page. Our website is full of information, lots of drop-down menus. Jay put that right in.
Yep. Yeah, Holly, you were going in and out your audio for some reason, but yes, the recorded webinar videos will be posted here. This one will be posted a week from now, but it's in the link there. When seeing Ngan has a question for Delta Dental PPO. Any ortho braces coverage for Delta Dental PPO and how much? I guess it's a really broad question, but Julie, if you can touch on that, please.
Yes, there is orthodontic coverage underneath the PPO plan, and I want to pull up to make sure I give you the orthodontia maximums are a lifetime amount. So if you go to a PPO provider, the orthodontia maximum is $2,500. If you go to a premier provider, it's $2,000. If you step out of network, it's $1,500. Regarding how much, it depends on the provider type that you're going to, because you're going to get the lifetime maximum if you're doing a full. As you're going through ortho treatment, if you're stepping out of network to non-contracted, they can balance bill you the difference. So really, if you're going, again, to do any sort of services over $300, even with orthodontia, they can submit to us a pre-treatment estimate. And that way, you know exactly what the treatment plan looks like and what you'll be responsible for. And it is available through adult and children.
And then there's a last question there. What is the difference between Delta Dental PPO and Delta Dental Delta Care USA?
Yeah, so Delta Dental PPO is a PPO plan, and you have no, there's actually no deductibles. You have an annual maximum, and then you have a lifetime of max. So you can go to services are paid on a co-insurance, and you have freedom of choice, meaning that you can step in network or out of network. That's your choice. Underneath the Delta Care USA plan, it is a DHMO. You have an assigned primary care dentist that you seek services for. If you need to see a specialist, they would refer you out. There are no annual maximums, and there's a co-payment booklet that I actually put the link in on the chat that you could download and even go to the microsite, and you can see every service that's covered under the Delta Care USA, you have a co-payment. So they're very different plans. The PPO freedom of choice, go where you want. You have a set amount of benefit dollars that are going to be available to you each calendar year. The Delta Care is a little more restrictive, has a little more rules, but there's no annual maximum. You have predictive costs because you know by your co-payment schedule what exactly the costs are, and it's low and no cost on most of the services. But you do need to go to your assigned primary care dentist, and you can change that. So they're very different plans, and I would suggest when you are comparing them that you go on to our website and you take a look at the providers that you have available and make that decision, because the Delta Care USA network, it's a closed network, and it's a little bit smaller. So you need to take a look and see what fits for your family.
And a question there for Julie again. Any teeth retainer coverage under the Delta Dental PPO?
If you mean a retainer, usually retainers are part of the orthodontia treatment. So if you're just needing a retainer and not going through orthodontia treatment, I would suggest that you have a pre-treatment estimate submitted to see if it's covered. I really don't want to comment on that because it's down to the dental code, and I don't want to misrepresent the benefits. But typically, a retainer is inclusive of the orthodontia treatment.
And for UHC, Monica, could you touch on that? Because it's like a similar question, but I guess it's kind of like a broad question there. Do your plans cover aligners as well, or only braces?
They only cover braces. They don't cover aligners.
Got it. Oh, thank you. Again, we still have a few minutes left. If you have any other questions that are lingering in your mind, we have our representatives here. Please type it in the chat box. In the meantime, if you want to request a physical guide, I'll post that in the chat box here. And again, thank you for our representatives today for joining us. Any other questions? Going once, going twice?
Jay, would you be able to just share our open enrollment timelines for people as a reminder?
Sure. Our open enrollment will, let me see, let me share with you our link here so you can go on our website. And again, our open enrollment ends on October 25th, 2024 at 5 p.m. But any information you would need to select your open enrollment plans will be here on the link that I'm just posting, especially for the new hires. You can find any information there. And again, if you'd like to see one of our specialists here at SFHSS, we do have walk-in hours, and the walk-in hours are from Monday to Friday from 9 to 1 p.m. And this is only during open enrollment. And again, I'll post it here on our chat box. And again, any questions you could think of, please feel free to type it in the chat box here. Holly, can you think of anything else that we could share with everyone?
I think you've covered it. We've got a lot of things in our chat, and that recording, like Jay said, is going to go up and be available. We also have a few more webinars about other benefits for the remainder of the month. So we encourage everyone to, again, go on our website, see if you have questions about certain ones, and jump on one of these webinars to be able to speak directly with one of our representatives and staff members to answer questions.
Yep. And I'll put this one on there, the calendar of our other webinars for another 2 weeks. You can see the link on the very bottom there. And again, these are all great questions so far. I think one just came in there. Any flexible spending webinars? Yes, I think we have one more. Let me just take a look at it. Let's see.
Jay, it looks like we had an FSA for CCSF, MEA, and the courts on October 7th. So there's one that was already presented, but Jay, let's keep looking for upcoming.
There's one on the 23rd, which is Wednesday of next week, from 12 to 1. And Nancy, you could also go in there and check to see that recorded one that just passed. Should be on our website already. And again, these are all great questions. If there are no additional questions, we can wrap this webinar up. Okay, seeing none. Well, again, we strongly encourage everyone to invite your colleagues to participate in these webinars so we can address as many questions as possible. And again, thank you for our representatives, Julie, Monica, and Nancy. Yes, there you are. And Yak. So again, you can contact us at any of the links that we have provided or phone us. And thank you everyone for joining, and you have a great day. Bye.
Thank you.
Thank you.
Bye.